Welcome back to Today on Bay TV. I'm Gaynor Morgan and I'm joined by Dr. Lamah El-Sharkawi and by pharmacist Reem Sharkawi. And we're going to, this is the first of a regular features, I hope, looking at our health and how we can deal with it. And I think today we're going to talk about the flu.
Absolutely, yeah.
Well, you two, Bishopston girls, I think, you look in the peak of health. But flu is a serious business, particularly this time of the year.
Absolutely. Absolutely, yeah. I mean, just to start off with a bit about what flu is about. So it's short for influenza, and it's a highly infectious respiratory viral illness which passes from person to person. When someone's infected, they can pass it to someone else by something simple like sneezing or coughing. The main symptoms of flu tend to be high temperature, you get generalised aches and pains, lethargy, like any sort of viral illness, really.
Reem, people confuse it with a cold. What's the difference?
So there are big differences between the flu and with a general cold. As you can hear today, Lamah has got a little bit of a cold, where it's things like you get a general, like, low-grade fever if you've got a cold, and you may have the sniffles and sore throat. But with the flu, as Lamah mentioned, you get an extreme high temperature. I think the symptoms are far more severe and probably don't resolve as quickly, do they?
Yeah.
As with a cold.
Yeah.
It can be really serious, though, the flu. So the flu, unfortunately, last year alone, we had in Wales over 600 patients admitted to hospital due to flu-related illnesses. So it can become in Wales.
That's a lot.
So it can become really serious, causing things like pneumonia, which obviously we'd want to prevent. Luckily enough, though, we've got the flu vaccine, we've got the flu jab, which is available at this time of year.
I think the seriousness is underlined. We've got a poster, I think, I'm not sure if the government's brought it out, but this is actually, this is who's brought this out? It's giving advice about...
Public Health Wales.
Public Health Wales, giving advice about how to cope with flu, the poster?
Yeah, so how to cope with it, and also there's a bit at the start you can see just about who's eligible to have the flu vaccination on the NHS. So the flu vaccination normally is it's an injection into the muscle for adults, so usually into the arm, and basically the way it works is that it's an inactive virus, so it's injected into you, and the body is able to mount an immune response, so it produces what we call antibodies, which are proteins which fight infection in the body. So that if then you're exposed to the flu virus, your body recognises it and is able to form an attack and kill it.
Now, I'm 65, I'm pretty healthy, I'm farming stock and all the rest of it. I don't think I need it. And I think we've got a lady who's going to tell us she feels similarly.
And my old mum used to say to me, old age does not come alone. Well, she got that right. It comes with a cast of thousands. And I remember that famous Hollywood star, Bette Davis. She said, growing older is not for sissies. So fasten your safety belt, you're in for a bumpy ride. Well, catching the flu is a bumpy ride. Then a relative became very ill, and I realised what a nasty illness it could be. It can lead to pneumonia, and some people may even die as a result of complications of flu. So now I make sure I have it every year. I didn't think I needed it because I was fit and healthy, but I do. Doctors recommend that everyone over the age of 65 and everyone with a chronic condition should have the free flu jab every year. You need it every year because the virus changes, it's sneaky.
Well, I don't think you'd catch me playing hula hoops, but why does she need it? Why do I need it?
So the target, the sort of subsets of groups that we target are people who are at most risk of the flu or at most risk of the complications. So, I mean, didn't she look fantastic?
Oh,
she really did. But I hope I look like that when I'm that age. But yeah, so anyone over the age of 65, if she touched on that, if you've got a chronic condition and you're aged over 6 months, like diabetes or asthma, then you should have it. Pregnant women are also a very important subset that should be having it, because it not only protects you, but will protect the newborn baby in the first months of their life as well. If you're a carer, or if you've got a weakened immune system, for example, if you're having chemotherapy, or if you're age 2 or 3, those are really the target groups that we want to get the flu vaccination done.
Reem, I'm a great believer in letting the body sort of fight for itself, and I'd be worried about side effects from the flu jab.
Yeah, good question. So we often get asked this in clinics and things. To be honest with you, the side effects are pretty minimal from the flu jab or the flu vaccine. You may get a mild fever after having it, or you may feel generally a few aches, but they should go after a few hours or even after maybe a day or two. The one thing I would say is if you've ever had any reaction to the flu vaccine or flu jab in the past, then it's important that you tell the healthcare professional before receiving the flu jab to make sure that everything's okay with you having it again. And likewise, as Lamah mentioned, we always advise patients, if you are right-handed, to have it in your left arm, for example, just because it can cause a bit of an ache after having the jab. But that normally goes within a couple of hours.
Well, Dr. Lamah, if somebody goes down with the flu, if they haven't had the jab, do they come straight to the surgery and spread it around?
No, it's best, I mean, obviously it depends on the severity, but it is best if it's a mild form of the flu, that most people will recover by themselves. Like I said, the body is very good at fighting infection and viruses. So just with rest alone or with paracetamol and ibuprofen, then it might settle by itself within about a week to 10 days. But certainly, if they're worried about sort of more severe complications, like we mentioned, like pneumonia, which is a lung infection, then certainly they should seek some help from their GP.
And Reem, to be more proactive, how do we go about finding out about the flu? I think I had a letter from my surgeon. I have no idea where it is.
Okay, so all our surgeries at the moment in the Bay Network cluster and in all surgeries in Swansea are offering flu clinics at the moment. So it would just be a matter of calling your local surgery, and it's a very quick injection. You'll have it within a couple of minutes and you'll be out of the surgery. You can have it in some local pharmacies as well, but as I said, always ring the GP surgery and you'd be able to get it.
So perhaps best to be on the safe side. It sounds as if it's a very serious business, the flu.
Yeah, absolutely, absolutely.
Serious times.
Yeah. So we have got a little bit of a quiz called Myth or Fact. If I can just give these to you.
I'm bound to fail this. Are you testing me?
Kind of.
Testing you, yeah, absolutely.
So the first question is, the flu vaccine gives you flu.
Is that
a myth or a fact? Correct, Gaynor.
Very good. So the flu vaccine, like I said, is an inactive a form of the virus, so it doesn't actually give you the flu. It's usually coincidental that someone has picked up the flu just after they've had the flu vaccination.
Okay.
If I get flu, I should take antibiotics.
Viral, isn't it? So is that a myth?
Very true.
Very good. So antibiotics only work for bacterial infections, and as we said, it's a viral illness.
That's a very hard one to come to terms with, because you do think the doctor can help you.
Absolutely.
Okay, I'm pregnant, so shouldn't have the flu jab because it will harm the baby. That, in fact, is actually a myth.
Well, it's not going to affect me anyway, but yeah. Why is it a myth?
So it won't harm the baby. Like I said, it'll be protective for the baby, so it'll protect the newborn.
Right. Okay.
And lastly, the word influenza comes from the Italian word for influence. Fact or myth?
I think that might be a fact.
Very
Yes,
good.
yeah.
It is actually from the Italian
We've got
word
a very
for influence.
Latin-based language, haven't we? So,
Yes, absolutely.
Yes, that's very. I suppose it does influence everything about you, doesn't
Well, they
it?
used to think that it was influenced by the planet and the moon and the stars.
Oh,
so
right.
I'm not sure that's the case.
Because you wouldn't really know where it came from, would you? It would just sort of
No,
come upon
absolutely.
you, I suppose. So, well, it's better than the influence of alcohol, isn't it? Well, thank you both. Very, very
Thank you for having me.